Kathy McCabe, and I practice cataract and refractive surgery on the west coast of Florida. And I've been using OMIDRIA for a very long time, and I cannot tell you how much it has benefited my patients and how it has made cataract surgery more predictable for me. I'm super excited to be here today with my very good friend, amazing surgeon, and just wonderful all-around person.
Thank you so much, Kathy. I'm so excited to be here with you. My name is Shamie. I'm a cataract, refractive, and corneal surgeon, as Kathy mentioned, from Los Angeles, California, at the Shamie Vision Institute. And I've been using OMIDRIA since it became available to us. Initially, I have to say I was apprehensive about its potential and its benefits, but as I got past my apprehension and really embraced it, I have seen incredible results, and we'll talk about them together, you and I, as far as the benefits we've seen and why we think that everyone should consider trying it.
Yes, and I think that that's one of the things. I totally agree with you. At first I thought, cataract surgery is pretty predictable for me. Certainly we have cases where pupils are smaller and there's less stability of the iris, but we're all pretty accomplished cataract surgeons. Why would we need this? And maybe just in special cases. But
I used to joke and say, bring it on. I used to say, cataract surgery, as you said, has become, pretty basic for us. We do so much, all of us, we do so much cataract surgery with that. So what if there's a little bit of a pupil shrinking during the surgery? Bring it on, challenge me, keep me on my toes. But as we all know, it's far more than a little extra challenge while doing surgery.
So there's a couple things, right? There's the challenge to us as surgeons, how it sort of wears on you and you don't even realize it as the day goes on. You have that stress level. Maybe your shoulders are getting a little tighter sooner in the day. And then there's the risk to the patient. So we know from studies, right, that if the pupil is smaller, then there are a greater risk of all kinds of potential traumas to the iris, inflammation in the eye as the iris is maybe impacted by instruments in the eye.
And chafing of the iris at the incision site, and discomfort for the patient at the time of surgery, increased inflammation, as you said, with the bellowing of the iris.
Right. Prolapse of the iris.
Yeah.
So, and you think about those things, at least I do, and I think, you know what, in those cases we have tools that we can use. So some of those tools are hooks and rings and maybe more dense, cohesive, viscoelastic, things that we've used to adapt to those problems. And maybe I don't need anything else than that. And then what was the aha moment for you, like using OMIDRIA?
The aha moment is when I started noticing less necessity for these extra tools that in themselves they traumatize the eye, right? Putting in hooks for the iris or rings for the iris, and as you said, taking these extra steps to help minimize the trauma to the eye. Well, if you preemptively prevent pupil constriction and floppiness of the iris, the aha moment was, wait a minute, several weeks have gone by and I've only had to use the hooks maybe once, whereas before every time I was in surgery with my large volume of cases like yourself, at least one patient needed some intervention. And I found that was my aha moment.
Yeah, or you were stressed in a case that you didn't need to be stressed in. And I think for me too, as I became more comfortable using it in special cases, there would be that occasional patient where I'd be, I think the pupil looks like it's well dilated. I think this is going to be a routine case. And then halfway through the case, the pupil comes down. And I'm thinking, if only I had thought that this was a case that needed it, maybe it would have gone in a more routine fashion. And instead, with hindsight or during the middle of the surgery, I'm wishing I had made a different choice. And so I started using it on more and more routine patients. And then I realized, my day went smoother. There were less moments of stress, less tension in my neck and my back at the end of the day. And that was really helpful. So, and in the journey with OMIDRIA, it wasn't always as accessible in every step of the way, right? So how did that change how you thought about it too? Did that give you some insight into what it was like not having it again?
I think initially, as I said, during the same time that I was apprehensive about the clinical applications of it and is it really necessary, there was also concern around cost and how are we going to implement this into our practice. But thanks to support from the company, and we have an incredible rep who has been really responsive to our needs, and it's covered by many of the insurances, and when it's not, there's ways to work with the company to offer it to our patients. So there hasn't been any hindrance as far as that's concerned. Access has not been an issue for us.